The delicate task of interpreting pediatric electrocardiograms, or ECGs, is akin to understanding a language that evolves with its speaker. As children grow, their heart's anatomy and physiology undergo significant changes, making pediatric ECG interpretation a specialized field distinct from adult ECG analysis. In newborns, a symphony of rapid beats ranging from 120 to 160 per minute is the norm, reflecting the high metabolic rate of these tiny beings. As they transition into infancy, the tempo slows to a range of 100 to 160 beats per minute. Toddlers and preschoolers continue this decrescendo, with heart rates between 80 to 140 beats per minute. By the time they reach school age and adolescence, their heart rates approach the adult standard of 60 to 100 beats per minute. The heart's electrical axis in newborns often presents a more vertical orientation, known as right axis deviation, which gradually shifts to align with adult norms over time. The QT interval, which represents the time the heart's ventricles take to contract and then recover, also varies with heart rate and age, necessitating correction for accurate assessment. When interpreting pediatric ECGs, it's essential to use age-specific norms and understand the normal variations that are particularly pronounced in infants and young children. Lead placement is another critical factor, with adjustments often needed for V1 and V2 in the younger cohort. Recognizing normal variants, such as early repolarization patterns, is crucial, as is the accurate calculation of heart rate, especially in irregular rhythms. Differentiating normal age-related changes from artifacts is a skill particularly useful when dealing with the squiggly lines produced by energetic infants and toddlers. And above all, clinical correlation is key. ECG findings must be considered in the context of the patient's clinical presentation and history. In the realm of pediatric ECGs, certain rhythms and patterns are more commonly encountered. Normal sinus rhythm, or NSR, is characterized by normal P-wave morphology, regular rhythm, and an age-appropriate heart rate. Supraventricular tachycardia, or SVT, is not unusual in children, often presenting with a narrow QRS complex and sudden starts and stops. Wolff-Parkinson-White syndrome, known as WPW, may be identified by a short PR interval and a delta wave, while long QT syndrome, or LQTS, is marked by a prolonged QT interval that can lead to dangerous arrhythmias. Bundle branch blocks, both right and left, may be benign in children, but can also indicate underlying cardiac conditions. Pediatric ECG interpretation is a nuanced art that requires a deep understanding of age-specific norms, normal variants, and common findings. In cases that are complex or present concerning findings, consultation with pediatric cardiologists or specialists is highly recommended. This collaboration ensures that the heart's language is interpreted with the precision and care that our youngest patients deserve.